Okay, thank you all for coming today. We're going to go ahead and get started because I know y'all have lots of things to do, and so do I. So what I prepared for you all today is I wanted to talk about how you streamline your administrative operations. And you're going to have to do that with a lot of good organizational skills. Everybody doesn't have that, but it's something you can put in place in the beginning, and it really pays off as time goes on. So as I mentioned before I started recording, I hope that some of you have brought questions that you would like to ask. And as I go through the presentation, if you have questions, go ahead and write them down. And at the end, we can go back and answer those. So as I mentioned to you all before, I like to break things down into a logical section. And I'm going to go over things that we can do for clients, employees, and for compliance in order to stay on top of things and just make sure that the office is running efficiently. So first, I want to talk about what we can do for our clients. When your nurse goes out, well, first, before your nurse even goes out, you're going to get some type of a referral that maybe will come in on the phone or however it comes in. But you should have a good way to gather all of the pertinent information that you need about that client. I have a form that's a referral information sheet, and it has all the things on there that I felt were pertinent that I needed to know about a client before I decided if I was going to take them as a client or do their assessment, and that's important. So if you have something like that made up and it's consistent, every client gets that. You write down everything. There's certain questions on there that you ask. And later on, as my business started to grow and I had an office assistant, I taught her to take that information if a call came in and I wasn't in the office or if I wasn't around. So I made sure as a nurse, I had certain things on that referral information sheet that I wanted to see before I called the client back and delve further into what their situation was. And so and I let her know, sometimes she would take those notes and there may be something she left off, and I would say, this is extremely important because I don't want to call the client back blindly and they've already given you the information. So if you make sure you get these 4 pieces of information, I can proceed from there. So think about that, because when you get a referral, you're going to have to decide, is this a client that I can take? Can we do this job? And so that's important. Also for the caregivers, I'm sure by now, some of you that have been in business a long time, you figured out that our employees or caregivers, they prefer to work with a client that's as close to home as possible. Some of them will drive a distance, but if you can logically keep those aides close to the client, that really works out for you. Right in the beginning, when I started my business, I had gotten this client that was in Apex, North Carolina. If you all live in the area, you may know Apex. Well, I had hired quite a few caregivers in the Lewisburg area. And so just not understanding, this is in the beginning, not understanding that distance was so important. I had planned to assign one of the people, all these people I had waiting for work in Lewisburg for Apex. Well, that's probably a 2-hour drive in the morning. It could be. And so quickly I learned that I needed to assign them clients as close to home as possible. And then later on, I noticed that if I called a caregiver or an aide and asked her if she would take a certain client, the first thing her question is where are they located? You know, that was the first thing they wanted to know. So that some of you do not make that mistake, it works so much better for your agency if you, of course, you know where your client is and you know where your aides are. And now you have these wonderful tools where you can just go right on Google and put the addresses in. And I learned to do that later, and I would tell the aide, well, it's only 5 miles from your house, or it's 8 miles or whatever. So that's just a nice tip for you all to have. As far as billing, On the referral sheet, you want to know how that bill is going to be paid. Is it going to be paid? Is it a Medicaid client because you're going to do something different? Is it a CAP Medicaid client? That's the Community Alternatives Program where they can get additional hours and they have a care manager over their case. Or is it private pay? Is it long-term care insurance? All of those things, as an agency owner and as a nurse, you want to know that up front because it makes a difference as to how the billing is going to be done from your vantage point. So I mentioned that you have a standard sheet to gather all the information. That is for consistency. You want to have the same information on every client because it's going to help you to proceed a whole lot better. And then you want to file all of your paperwork consistently. We would file the client paperwork in these 1-inch binders, and we had certain tabs in there. One of them was the client information. The other one was the assessment, the care plan, the nurse's notes, the supervisory visits. All of those things were filed. If you're doing paper, you know, if your records are paper now, you're not with a vendor yet, and some of you are not because you're new. Make sure everything is filed the same way for every client. So if you get a phone call, you can go quickly to that binder or wherever you have that information. You can pull it out and you know exactly that it's there. Or if it's not there, then you know you have an issue. You need to find it and make sure that it's in place. A lot of the information that you're getting on these clients will change as you start to work with them. And the way you know about a lot of those changes is that when the nurse goes out for the supervisory visit, she may find out that they've been in the hospital. Hopefully, you know before then, unless they went in that day. But has there been a hospital visit? Do they have a new diagnosis? All of those things, you want to keep your records up to date based on what that nurse saw when she went out there. And hopefully she's writing in the chart and she's doing that. She may even have to rewrite the care plan because the client's needs have changed. And so she needs to go in and totally rewrite the care plan. You may need to change the aid because the level of care has changed. And also with your quarterly reviews, you want to be sure that with those, that you're looking at all of your clients and making sure that everything is consistent and that you're doing the same things for each client based on what your regulations are. And then let's look at our employees. For your employees, you're basically dealing with 3 areas. You're looking at if they have a license or if they don't need a license or whatever kind of work they're doing. Of course, an RN needs a license. Those aides that are on the nurse aid registry, that's not a license, but it needs to be updated. You're looking at their health status, their hepatitis B, TB, and now COVID. You're looking at all of that when they come in. And then you're definitely doing background checks. All of these things are required according to your licensure, but that's what you're collecting on your employees. I also suggest that you have a standard packet to collect all employee information. And if you have that on every employee, if you have a packet and there's a form in there for collecting hepatitis B information, then you go ahead and put the employee's name on there. But if you look in the file and you see you have no hepatitis B information, they did not decline to get the vaccination, then you know that you're out of compliance. So the reason that you want these standard cover sheets or whatever in there is because it prompts you and reminds you that something is missing. And when you get a survey or an audit, you have that information in place, or you've notated the reason that it's not there. Either they didn't need the hepatitis B or they declined. You have that information in place. Also, I have noticed that in the last 6 months, the licensure consultants are really concentrating on job descriptions. They read those job descriptions word for word, and they want to be sure that the task or that you're expecting that nurse or aide or agency director to perform, that they're on that job description. So if your agency was licensed 10 years ago, you probably need to go in and look at your job descriptions and make sure that they're up to date. because you really cannot hold a person to performing a task or a duty that is really not on their job description. So that is important. Also, on the validation of new skills. When you take on a client, they may be still up moving around with their walker or whatever, and if you're an in-home aid agency, of course, as that person's condition worsens, you can stay with them. You just put the right level of aid in there. They may go all the way to needing a Hoyer lift. Well, you'll need to make sure that aid is trained on that Hoyer lift, that he or she knows how to use it. Also, if they need compression hose, or stockings, that is so important, because if those are not put on right, it can really hurt the skin and the client. So you want to be sure that they know how to adequately put those hose on a client if they need it, because that's something a client needs help with. You can assist a client with their blood sugar checks, but if you have your aides do that, you need to validate that skill. You need to see them go through the entire process and make sure that they know how to perform it. These are just some examples, but make sure that if there is a new skill introduced in the client's home, even though you've checked off and validated their skills initially, you need to make sure that if there's a new skill, that you have validated that employee can perform that skill. And then I wanted to talk to you all about compliance and rules and regulations. If you're already in business or before you get your license, you're going to have a set of DHSR licensure rules that your policies and procedures were written to match. So if you have policies and procedures, go through and read everything that's in there, because when they come out for a survey, they're going to look at your policies and procedures and hold you to that. If you said that your aides were going to have 5 hours worth of in-service per year, and they look and see that, then they're going to go to your log where you're logging in the hours, and they're going to see if you're following it. Many times people or agencies get deficiencies because they did not follow their own rules. So that is important. You don't just have those policies and procedures sitting there just because you had to have them. You have to follow them as well. And then there's also something in the licensure rules that says you have to follow all state and federal laws. That would be labor laws. And one that I think of immediately is that if an individual works more than 40 hours a week, that you need to pay them time and a half for the additional hours. Also, if there are additional health rules that the state comes up with, as far as masking, or if they want you to start doing, rather than a TB skin test, that you do a blood test or whatever, you need to follow all of those rules. And this is a good time for me to mention the Association for Home Care and Hospice here in North Carolina. They are so good. They have a legal team and they stay on top of all of these things. When I was in business, I was always a member because I knew that if something changed that was related to my business, they were going to let me know. They first look into it and break it down for you and let you know this is what you need to do as an agency. And they also advocate for the home care industry. So I'm definitely a big advocate of the Association for Home Care and Hospice. Your insurance is very important too. In North Carolina, if you have more than 3 full-time employees, you're supposed to have workers' compensation insurance. Talk to your insurance agent about that. And of course, you do not want to run a business without liability insurance. That is just extremely important, especially in the business you're in. So just make sure your insurances are up to date. There are agents around the state that are used to writing this type of insurance. So it's good to find some of them that know exactly what you need. But this is just a very important area, all of your insurances. So what I wanted to make sure you all know is that I am so excited about bringing you all together and giving you information on a monthly basis. Many of you call me, but I want you to know that if before you make any major changes to any of the information or your agency, make sure that it is in compliance with DHSR licensure rules. I check that, but I want you to do it too. And that it's relevant to state and federal laws. And then if it's something legal, consult your legal counsel. It's good for us to get together and I want to provide the information, but I don't want you all to assume that this is the only answer that you need. And that if it's something that really affects your business, please get legal counsel before you make a major change. And so that's basically what I had for you all today. And I wanted to go ahead and see if you all have any questions about what I just covered, or if you have questions that you brought that aren't relevant to what I talked about today. We'll go into our, free forum right now. If anyone has a question, you can just open your mic.
In reference to the insurance, the general liability and the workman's comp, what companies do you suggest?
Well, my
that are familiar with home care.
Okay, my suggestion is that you go to an insurance broker. And the reason I say that is don't just go to an agent, because every agent is not going to be familiar with your industry. But if you go to a business broker for insurance, there are really only certain companies that will write this insurance in North Carolina. And I remember there were several times that I had to change companies for workers' comp, because I was at one time with a company that said, we're not going to do this insurance anymore in North Carolina. But because I was with a broker, my broker can write insurance from many insurance companies. They would put me with the next company with the best rate. So that is the best advice I have, Casey, is that you go to a business insurance broker, because they will know who can write your insurance and they will know how to get you the best rate.
Thank you.
Thank you, Patty. Hi, this is Kate from Illinois. How are you?
All right. Nice to see you.
Hi. My question is anybody doing CLEAR, the COVID testing in addition to home care in this group? CLEAR is clinical laboratory waiver that has been approved by the federal government. Anybody?
Yeah, this is Paris. I'm actually looking into that right now. And I'm going to try to get my application in the mail over the weekend. But I am actually looking into doing, I'm not doing it yet.
Okay.
What is it? Today? Clarify
CLEAR,
what
we
it is.
can
CLEAR?
do COVID testing.
This is a waiver program. As you know, because of the COVID, the government, I believe I just read that the government kind of is pumping a lot of funds into any program that will get involved with testing individuals for the COVID-19 testing. And so I was just wondering, because I just got the license, but I wanted to find out how we're going to be paid. But I guess I will keep on with my research. And if I find something, I'll let you guys know.
Okay, that'll be fine. I'm not familiar with that program. I'll look into it, but I would just say, whatever state you're in, make sure that it is within your scope of practice. So
okay,
even if you can fill out the application and they say yes, check your licensure rules and be sure that it is within your scope of practice. So Paris, you let us know what you find out maybe in our next meeting, but that's what I know about it for right now. Kenya Gomez.
Are you referring to the CLIA lab, CLIA CLIA
Yes.
lab? Oh, okay. Yeah, I do
Do
know.
you know anything?
I know a few nurses that have gone and taken like the class to be certified to be able to administer COVID testing, but I don't know what the process entails. And they don't have home care agencies. They have other nursing businesses. And this was a branch of the business. I would be cautious and echo Ms. Williams in that make sure it's within your scope. Because from my thoughts, I thought it was like a clinical background where you had to be able to administer the test, like you have to be a nurse. So just kind of confirm the details of that and complete the training that's required by the state.
Okay, thank you.
And Kenya, now, most of them that do in-home aid, they'll have a nurse at their agency, but that does not say that nurse can do everything within her. It can't be outside of your agency scope of practice. Another example, you have RNs working in your home care agency. If you do in-home aid, that RN can administer medications, but she can't do it under your home care license.
Correct. Absolutely. That's correct.
Just keep that in mind, that you need to stay within your scope. And for those agency owners that are not nurses, protect your nurses. Because sometimes your nurses are not going to think about, well, we're not really licensed to do this. And they may step out and do something because you're the owner and you really haven't said to them, they think that you're within your scope of practice. So make sure that you don't ask your RNs or even your caregivers to do things that are outside the scope of practice for your home care agency license.
Okay, thank you, Miss Patty. I appreciate you.
Mm-hmm.
Thank you, Paris.
Any other questions about anything today?
Yes. Hello, Ms. Williams. My name is Christiana Mackey. And the question I had to ask you is, what are everyday obstacles you face as a business owner?
Can you repeat that?
I wanted to know, what are everyday obstacles you face as a business owner?
Obstacles that I faced.
Yes.
Oh my. I would say the major obstacle that I see people facing today is getting caregivers to match up with the clients that they have. But as far as when I was doing it, the caregiver, there were not as many agencies as there are now. So the caregivers were there, the clients were there, and one of the obstacles was, as I mentioned earlier, is making sure that the right client was with the right aid, because even if you do get them within proximity of that client's home, you also have the situation of, is it the right person? Do they get along? You may have to change those assignments. So that's one of them. But you all that have just gotten into this business, you jumped a lot of hurdles just to get into business. You established an LLC, you had to send in those policies and procedures. Many of you are getting qualified for Medicaid. You've done a lot, so you've overcome quite a few things just to get here. And it's usually very, very different depending on where you are for every agency. You just never know what the next thing is going to be. But I would say always be prepared for whatever may come up.
Thank you so much.
Someone just was talking about SBI criminal background checks. Does someone want to go into detail on that? Okay, you all know that you have to do a background check on your employees. And if you don't use the SBI, you need to use an agency that is using a state-approved database. There are some of you that use ADP or whomever, but as long as they're using the state database that is updated, basically the same database that the SBI is using, you can do that. But at one time, I called one of the consultants and I asked them about who should you use for background checks. And they said to me, of course, what I just mentioned to you, and they said, but we like to see you use the SBI, though it's not required, but you're in good shape if you are using them. Any other questions?
Yeah, I had one.
Patty.
Okay, who was that? Go ahead, Frank. And I think
okay.
there was someone.
Yeah, I thought I didn't mean to cut somebody off. On the we don't have any VA clients, although we're certified with the VA and are thinking about providing some of that care. One of my questions was, is their reimbursement rates pretty good, but some of our caregivers, lately are kind of demanding a little bit more. And so is there a way to put a surcharge or a billing? Can you bill the customer for, let's say that, you wanted to bill $2 more than what the VA was paying? Is there a way to pass that along to the client? Or is it like, I know with Medicaid, you actually have to accept what Medicaid pays and you agree not to do any more. But is that the case with the VA?
Frank, I would think that the VA is like Medicaid, but I don't know. But if you are qualified to do VA, that should be in your contract. Did you have to sign a contract in order to be one of their providers?
Yes.
Okay, look at your contract
Okay.
and be sure, because that's going to be tough. If you're doing VA and if Paris's agency is doing VA and you're charging $2 more and she's willing to go with the rate, even from a competitive standpoint, it wouldn't be profitable for you. But look at your VA contract on reimbursements and what you're allowed to do and see if they will allow you to do that. That would be my suggestion. Does anyone else on the line have any information about that?
Yeah, I don't think those rates are negotiable at all. I think they set the rate and that's kind of what it is. Kind of like the PHPs that are serving for Medicaid. There's no negotiation. That's the rate.
Okay. Thank you.
And if we hear anything different, Frank, we'll let you know. Okay, so there was someone else about to ask a question when Frank started. If you will go ahead with your question. Was it Christiana?
It's Karima. How you doing, Patty? Hi, everyone.
All right.
I just received my licensure for home care, non-medical in South Carolina, and I go about applying to be able to accept insurances like Medicaid and VA and the other insurances that are out there.
Okay, you said you're in South Carolina?
Yes, ma'am.
Okay. Well, here in North Carolina, we have a Medicaid division that we go through, and once an agency gets their license, they have to go through a significant set of steps in order to qualify. I would think that South Carolina is very similar. So you need to find your Medicaid or Division of Medical Assistance or DHHS and find out how you get your agency qualified for that. And it would be the same if there were other companies that you were going to accept their clients. You would find out from each individual company, what are the things that my agency needs to do to be able to be reimbursed for servicing your client.
Okay, thank you.
Anyone else? Okay, well, that's basically what I had today. I'm not going to hold you all.
Actually, Pat,
go ahead, Frank.
sorry, I just had one that's not really a question, but so much as we are looking for a part-time nurse. And I don't know if anybody else needs a part-time nurse or would be interested in splitting that, or knows somebody that is interested in getting a few extra hours. We could use them anywhere from only 6 hours a week, probably up to
What area are you in?
Raleigh, Angle.
Okay, yeah, I'm looking for one part-time nurse as well. I'll
Where
let
are
you
you,
know
Paris?
if I come. I'm in Nightdale.
Okay. So your clients are in Raleigh and everything as well?
Yes, I have more on this side of town though, Eastern Wake area, but I do have a few in Raleigh too.
Frank, I'm going to be honest. You just, what is the pay rate? Because, I do have nursing friends, but I would have to be able to provide them a pay rate or range.
Yeah, we put the range we put is 28 to 32, and ideally we would pay them $30 an hour. So pretty good, I think, in general. I mean, I don't know what y'all are paying nurses. Does that seem about right? I don't know, Patty. Do you know based on kind of the market?
I don't know because I was a nurse. I was always my main nurse, and I used my nurses as contractors, not as contractors, but PRN. Mm-hmm. And so I paid them somewhere around in there based on what they did for me. But I did not have them set 20 hours a week or 10 hours a week. I paid them per supervisory visit or admission. That's how I did it, because I could cover all of the rest of everything myself because I am an RN. So that was a little bit different. And you have an RN as well, right?
Yes.
You could consider that too.
That's a great idea, Patty. I remember you talking about that, and I would be open.
Yeah, that would be good too. Any other questions? Okay, thank you all for coming today. We'll put this video on YouTube once I edit it, and I'll let you all know where it is. And if you will subscribe to our YouTube channel, then once we put something on there, you'll be notified. But I hope that all is going well for you all. Take care, and we'll notify you of our next next meeting next month, which is the second Friday of each month at 1 p.m. And until then, you all take care.
Thank you, Miss Betty.
Thank you. Bye-bye.
Thank you.
Thank you.
Bye.